Morning, everybody. I'm delighted to be here. I go back to my point in my office about 2 or 3 months ago when Oliver came to see me and we were chatting about a number of things, but he mentioned he had heard me talking about something called public patient involvement and my plans for this in the Health Research Board over the next number of years. And it was on that basis that he mentioned what today was about and the opportunity for me to speak a little bit about that. I'd like to stand. Is everyone hearing me okay? The mic's okay. So let me tell you a little bit first about, in the context of that, just some context of what the Health Research Board is. By the way, there's some dense material in some of the slides here today. You are not meant to read it all. I just am so used to people saying afterwards, can I have a copy of your presentation? So it's done that way for context. There are, however, some very key messages. At a summary level, the Health Research Board is a state agency in Ireland, funded primarily by the Department of Health. It has 3 functions you'll see here. There's an evidence unit providing policy work mostly for the Department of Health, but also more recently for the HSE. And you'll have seen things we've done around things like the alcohol diaries. If any of you remember to last summer when the rather pivotal information came out to show the Irish drinking patterns, not just volumes, but the patterns, etc. That was us behind that. More recently, assessment of the evidence on water fluoridation, the community water system. We also do a good bit of work in the kind of data space in drug use, disability and mental health, primarily for planning purposes, to enable the system to plan services, etc. And probably the area, is there a laser point? Yeah. The area that most of you, I suspect, in this room are familiar, and this is 90% of our actual financial muscle, goes into actually the funding of extramural health research in the areas that are mentioned here. Projects, building capacity, training people, and infrastructure. Now, one thing I like to point out about healthcare, and this will be no surprise to many people in this room, but very few people will argue with the fact that it's a knowledge industry, okay? With the traits that are generally up here. Expectations and costs are rising out of sync with our ability to resource them. Obviously, we need a much smarter use of those resources. But the thing I'll say, and I'm going to focus on this a little bit, I think our health service, our health system struggles with the self-learning capacity. And I'll show you 3 sets of figures now. Some people in the room I think have seen this before. For each organisation, I'm going to show its total spend, and then I'm going to show its spend on research and development, and then I'm going to express one as a percentage of it. You get an idea how much focus goes into R&D as part of the model. So the first one spends between 13 and 14 billion euro. The R&D spend is in the region of 43 million, so one expressed another. This is what we call a research intensity of about 0.3%, okay? Just a simple ratio. The second one spends about 109, 110 billion sterling per year. The R&D investment is somewhere around the 2.5 billion mark. That's an intensity, research intensity, about 2.2%. And the third organisation spends about $53 billion overall, 2.8 billion on research, so it's got a research intensity of about 5%. You might notice the currencies give it away a little bit. I'll show you what those organisations are. The first one is the Irish Health Service, and that's the HRB's budget at 43 million. The second one is the National Health Service in the UK, and the 2.4 billion is the combined budgets of what's known as the NIHR, the Wellcome Trust, and the MRC, and so on. And the third one there is Intel. But it's interesting, okay? If you are relying on knowledge, and you saw Oliver's slides earlier on, to push you forward, I think this self-learning capacity is something that's missing from our system here in Ireland at the moment. I'll come back to that in a while. Very quickly, the Health Research Board, that 43 million bit I talked about earlier on, invests in 3 areas. I suppose you'd call it projects and programs, a range of which are mentioned in the circles around the board at the moment. I won't go through them all. I am going to come back to the ones circled in yellow. I'll do that, assuming I can work this thing backwards. We do a lot of career development, training people at the student level, the postdoctoral level, and then the sort of leadership level through various programs that are mentioned here. And obviously we invest in sort of infrastructure and enabling support. And if I've got this working, the 2 Circled in yellow, there's one on the All Ireland Hospice and Palliative Care network that we fund. I'm going to talk about public patient involvement, does this quite well, and in particular we have a scheme with the Medical Research Charities Group, MRCG, where the patient involvement piece is strong. But there aren't many yellow circles, are there, on some of these slides here? So are we good at public patient involvement? I'm going to use this broader definition of public patient involvement. Obviously it includes the direct patient piece, but it is in fact a broader engagement of society when it comes to research. Being perfectly honest, say I don't think we are particularly good at this. I think we have to be candid. And as evidenced by the yellow circles I showed you a moment ago, even if I pick that scheme that we're quite proud of at the Medical Research Charities Group, it's probably 1 million out of 40 each year. So that gives you a sense of scale. That's the main evidence of how we're doing it. We obviously have some way to go yet. Okay, when we fund scientific research as a funder, we typically issue what's called a call for proposals. We announce the general area, we announce the general scheme, and then we invite proposals in. It gets referred to as a call or an instrument. One of our main instruments is this one here. Where is it? There. Health Research Awards. If I talk about this one being about 1 million a year, that's nearer 12 or 14. So if you want to look for some bang for scale and to try and get something to scale up, this is an obvious focus. Okay, so let me track forward. When we put out our call for proposals to the scientific system in 2014, the Health Research Awards, HRA, our probably biggest hitter, if you want to put it, what did it have to say about public patient involvement? There is no text on this slide. Philip asked me, is that deliberate? It is, because we didn't say anything about it. And that's, I'm being very candid here today and honest about, I think hopefully I will be given wriggle room in terms of what we need to do, but that's what we said last year. Okay, I joined earlier this year. I've obviously made public patient involvement one of the kind of central things I want to develop over the next few years. And don't worry about the text-heavy slide, but the 2015, the more recent version of this Health Research Award scheme had this to say about it. So we have a new development here on our biggest funding instrument for research. Okay, I do not expect you to read all of this. Okay, this gives all the good reasons for doing what gets referred to. If you hear me say PPI, it's public patient involvement, okay? All the reasons for it. But effectively what we've done is we've made it, we've announced to our community of researchers that this is now important to us. Again, if I'm very, very honest, I don't think we know quite how to do this yet, but I think in our first instance we're sending a strong signal, okay? And we've asked researchers to put into their application how they are engaging with public patient involvement in terms of their proposed conduct of the research. And we go even further, that in their submission to us, there is a section which requires them to articulate exactly what they do. Now it's short. I'm a strong believer that you've got to learn to walk before you run. I'll come back to this theme later, but this is quite a significant development. So we're actually mandating this from our research community in this, our main funding instrument. Again, I don't expect you to read out but the important thing is the signal that has gone to the research community. And for example, when we bring in our reviewers, and this is about the strength and weakness of this approach, when the reviewers, typically international scientists, clinicians and so on, I'll come back to the patient piece in a moment, they come in from abroad. We generally don't use anyone from within Ireland because of the closeness to the academic and research system. They go through a number of criteria, the X and Y's, I'm not going to go into all that, but we've added a criteria here that will be specifically evaluated and measured, which you'll see at the bottom here, the extent to which public involvement is incorporated into the research proposal. I need to get some water. Now, this is a typical, it's simplified, but your typical stages in the research journey, if you want to put it that way, from the view of a funder. A topic is selected, so we'll come back to that in a moment. How are topics selected by the funder? And who makes that decision? How are proposals prepared by the researchers? And I'll just leave the "and" empty for a second. How projects are then selected by whatever review mechanism, and I've just referred to that now in my previous slides, etc., how we hope to advance that. Then when the work is actually being done, where is the conduct of it? Then the implementation of it, because we generally are doing this research with the view to actually putting it into practice. That's where we want to go ultimately. Think of the health service here, and then obviously evaluation. I think we haven't, I'm quite open about it, I don't think we've been particularly strong. If you look at internationally, particularly our nearest neighbour in the UK, we're way ahead on this. We haven't been particularly strong on this. We have examples, as I said, with the Medical Research Charities Group that's going to be around these two steps. And I hope with what we've done with the Health Research Award Call, by making it a specific requirement that will be evaluated, we will significantly strengthen these two areas. I don't take it lightly. I think this is going to take the guts of the next 5 years to build this. And I'll talk more a little bit in a moment. I see Evelyn there previously of IPOSI. IPOSI were partnered in this EUPATI project, which is about kind of training, building materials and training sort of patient groups, etc. Because quite frankly, we need help. We need help in doing this. I've been in contact with Simon Denegri of Involve in the UK, which is the organisation leading a lot of this. I think rather than trying to do absolutely everything ourselves, we'll try and get some help between the likes of Involve and EUPATI, etc. How are we going to bring in a standardized, effective system of evaluation? I think we'll start there. So that we're quite used to, in the HRB, we would have, 40 projects that have been peer reviewed. We bring them into the HRB. We have experts brought in from around the world who grill it then, are they statistically powered? Is it the right methodology, design, biologists, clinicians and everything else? We're not particularly good at reviewing it from the perspective of the public patient engagement piece. Not particularly good at all, but I think we're starting that journey now. I suppose that's the positive, that's the bit of light I hope you're seeing here today. I don't know if any of you have seen this, but in April this year, the organisation in the UK called Involve, which was set up about a decade ago, I think, by the National Institute of Health Research, and that's the one that's chaired by the man I mentioned, Simon Denegri, published this report. I encourage people to read this. I mean, they've been at this for 10 years, and they had an honest look at themselves about what works well and what doesn't. And for me, again, I don't expect people in the room to read all of this, but you can take snippets. They've made mistakes, and they freely admit it. I think in general, they've got a good system going, and it's now, quite frankly, in the culture of research funded by the National Institute of Health Research in the UK, the whole patient piece of it. It's not over there. And I don't want us to make mistakes in doing this. I mean, I'm minded. I used to work in technology, as Tommy referred 2 years ago. I was in a different industry with a company called Accenture, and I can remember people talking about, CEO talking about, I want an app. And you're saying, yeah, but what do you want the app for? And you're, I don't know, I want an app. And you don't want this to happen with the public patient engagement piece. It has to be for real reason. I fundamentally believe it improves the quality of the research. That's probably my selfish motivation here. I also believe it tightens the link between that research and its need. And ultimately then, quite frankly, increases its chance of successful implementation. That will be my agenda. There are many others. So I want to avoid the pitfalls as we do this that have been made elsewhere. More examples. Again, I don't expect you to go through all this, but it's quite interesting. If I just take a piece here, just in that, there's also a concern about professionalisation, where experienced patient advisors feel they are penalised for gaining expertise and are labelled as professional patients. It's very interesting, coming from the UK experience. There's 10 years of experience in doing this. They also make the point, I think, if I remember rightly, their experience has shown them, with the best efforts they've made, that it tends to be a small group who do a lot of the work. I make this point over here about, PPI is public patient involvement. Architecture tends to call for a small number of individuals to make a massive commitment. That's not sustainable, and it's not what we want. It would have to be much wider than that. So these are some of the kind of, I suppose, things we want to learn. If we're going to try and get to a self-learning system, we're going to have to learn from other jurisdictions who have done this. So I think we've taken a step in the right direction. More from that particular report, going the extra mile. The key thing here is there are people who are good at this. We have some of them in this country. We also need some international help with it to try and build a system over the next 4 to 5 years that's going to make this an integral part of the research priority setting, the selection system, and the conduct, for all the reasons I've explained. Here's another slide with a lot of blank on it. The important thing is, probably just to show, I hope, some credibility, my organisation is just about finishing up a 5-year plan strategy for the next, out to 2020 or so. And one of the key actions, it's not published yet, so it's not out there, but this is a stated action in that 5-year plan, okay? All the actions and everything that sit below it, quite frankly, have yet to be worked out, but the important thing is that we're ring-fencing some budget and making a strategic commitment in our 5-year plan to doing this. I think that's, I hope, opposite in the context of here today. Also, quite frankly, saying we don't know exactly how to do it, okay? And we're quite clear about that. So we're going to, it's interesting what Oliver said about partnerships earlier. We will do certain things, and no doubt, like with all partnerships, you fail at some points in particular aspects, but if you've got enough trust going, you can get over that and build the system and learn. So I'm mindful that, sorry, I'll go back. I'll close with a comment that I used, I think, at an IPOSI UPATI event a month or two back. It was a quote of Benjamin Franklin's that I particularly like in the context of something like this, and I think it goes, tell me and I forget, teach me and I remember, and involve me and I learn. And I think that spirit is quite good of what we're trying to do here today. Thank you very much.